Do you think that you have mental health issues after the pandemic?
I believe that after the pandemic, many people started having symptoms of depression because of the non-physical touch and contact social life with many people. The having a close life just in a home that many people were suffering was really oppressed for them. But in my case, I think that having a extrovert personality made me start feeling anxious symptoms, getting nervous after presentations or talking to people. But it's something positive because anxiety is not something bad if you know how to control it.
And what challenges did you face and how did you overcome it?
Well, the main one was my state of my own mind, changing my routine and knowing how to manage my emotions, and with my family, of course, and my friends, how was the communicator and how was my day with my family. But well, a lot of changes in that.
I think after pandemic, the most of what we saw in terms of mental health, after being enclosed in their own comfort zone, was that they started to feel really lonely.
Taking into account mental health consequences of the COVID-19, we are going to analyze the data, the articles, and also every interview that we got to do with some professionals to get to know more about the consequences of the COVID-19 after the pandemic and how did it affect our mental health. So during this program, we invite you to think about how did the COVID-19 affected your mental health? Because this is an international issue and it's something we have to talk. Why? Because we were stuck in our houses and we had to stop everything we did in our everyday life. And this was a pandemic disorder that can have a lot of consequences, and that's how we are going to analyze during this program. So now let's talk about the data. If we get into the analysis among the world, and the cumulative incidence of mental disorders was about among survivors of 58.9%. Broken down as follows: depressive disorders 44%, PTSD 47.8%, and at some point of the outbreak, panic disorder of 13.3%. Did you know about this data? If you didn't, and if you want to get to know more, stay connected because we were going to talk about this analysis and also what people were willing to tell us in their personal feelings and interviews and how everyone experienced all this disorder of the COVID-19 pandemic. Let's get connected.
Okay, I am professional in psychology, psychiatry, and overall mental health. Fields currently experiencing significant growth. Have we ever paused to consider that our daily lives is hang on mental well-being? Today, I present the subject of mental health post-COVID. Okay, Diego, could you share your initial awareness of the COVID-19 pandemic and describe the emotions you went through at that time?
Sure. Some of my initial awareness about COVID or thoughts about COVID were that this small virus was only happening in the other side of the world, so I didn't pay that much of attention and didn't care that much until it came into our country and everything started happening really fast. Everything was getting shut down, schools, malls, airports, everything. And even remember the day that I got the email from the school saying that I needed to stay in my house because of the complications, COVID complications. So it was I don't know what's happening. And the emotions in that moment were there were many emotions happening at the same time. It was what is happening? I never experienced something like this before. So anxiety, sad, stress, many things happening at the same time, and that feeling of not knowing what's going to happen is in some ways scary. So yeah, so that's basically, it was everything new, everything was weird. So yeah.
What precautions did you adopt in your daily life to curb the spread of COVID-19, and how did these measures influence your routine?
Well, what can I say? We, not only me with my family, we adapt like many things into our lives with this COVID thing. It came the COVID protocols like washing your hands, distance, the face mask. It was some of the things that really impacted because it was now part of the outfit, like for our daily life. If we wanted to go outside, even for a walk, like just a face mask. One that I can say that it was like, it was impressive was when my parents get the groceries, like I needed to spread alcohol into the bags before getting the bag into the kitchen. So it was like getting the bag, getting like a whole bottle of alcohol into it, and then just organize it. The other thing that really impacted was like my parents getting back from work or getting back from somewhere, and just waiting for them to change clothes or put alcohols in themselves before giving them a hug. It was hard, like just wait to that process, hands, alcohol, change, like everything was like, what the heck is happening? So I can say that it really influenced, I think, not only me, like a lot of people into our daily routine.
Did you grapple or related with feelings of anxiety, stress, or fear during the pandemic? If so, how did you manage and cope with these emotions?
Actually, it was the three emotions that you just mentioned, like anxiety, like already said in the previous question. Uh, like many things happening at the same time was just overwhelming. Stress, yeah, sure. Because it was dealing with the school, like in the virtual thing, keep trying to keep my grades up, or also because of things that happen here in my house, like also keeping an eye on my chores, like keeping the house under control, we can say. Also, I had a a pet, so many things that I wanted to keep in control that I couldn't, and it was like, I'm trying, but I couldn't. Fear, it was most like I didn't know what is going to happen, so that was scary. How did I overcome all these problems? With like talking to friends, listening to music, playing, like doing like some activities that help me like to either focus or just calm down. So, and also thinking that this COVID thing at some point was going to end, that it was only temporarily.
How did you adapt to remote work or study arrangement during the pandemic? And what obstacles did you encounter? And how did you surmount them or replace it?
It wasn't that hard to adapt like the study into our house, well, in my house, because the school that I was already had this virtual stuff going on. So we had like one day, let's say Friday, and we just stay in our house and do our homework, attend to classes virtually. So we already had like the platform and the emails. So when the pandemic started in Colombia, like in 1 week, we already had classes. It was everything really fast, and it was, in some way, it was awesome, but it was hard in the way that even though that I was in my house, it was hard to concentrate. Like I couldn't pay attention, I was lazy, and actually paying attention to class, it was hard because it's not the same like taking the class there, like in person, like being there with your classmates or with the teacher. It was really different just sitting here and on a table and just watching a screen. It was hard, but uh, then we adapt. Like I adapted to this virtual stuff, and then it got like easy in some way. So yeah, that's basically it was weird.
And the last question is reflecting on the pandemic. What insights have you gained regarding mental health, and how do you plan to integrate this lesson into your life for a new knowledge?
I learned many things from the pandemic or with this experience. Before the COVID-19 situation, I didn't care that much about my mental health until it came like suddenly, and I noticed that even though that physically I was doing well, I was good, because of my mental health that wasn't stable. Many things changed. Like I wasn't being productive. I didn't want to do stuff. Like many things changed in a bad way because of my mental health. And then I realized that we should care and pay attention to it, because in this case, it was the pandemic. It was the COVID-19 that made my mental health go like down. So we should be prepared, and that's something that I try to apply to my life. Was like always be prepared, so that in this situation our mental health is not gonna get like so impact like in the bad way. So we should be always prepared and be ready for anything that can happen, because this, like I said, this time it was the pandemic, but it can be anything. It doesn't have to be that bad. It can be something new that is happening into you, and just be prepared so you can be like healthy in that way.
11 post-COVID-19 self-care tips. First, establish a routine. Creating a daily routine provides you structure and predictability, which can be comforting, including some activities that bring you joy and sense of accomplishment. Second, practice mindfulness and meditation. Mindfulness and meditation techniques can help you to reduce anxiety and stress. Consider practices like deep breathing, guided meditation, or yoga to bring a sense of calm. Stay connected. Social connections are vital for our mental health. Stay in touch with your family and your friends, even it is through virtual means. Share your feelings and your experience, and listen to others as well. Fourth, limit news consumption. Stay informed, but be mindful of the amount of news that you consume. Constant exposure to pandemic-related news can contribute to your stress. Set specific times to catch up on updates. 5. Physical exercise. Regulating physical activities is linked to improve your mental health. It doesn't have to be intense. Activities like walking or jogging or home workouts can be beneficial for you.
Also, maintain a balanced and nutritious diet. Certain foods can positively impact mood and energy levels. Have you tried when you're feeling sad or you're feeling blue to eat some chocolate candy? You will feel better after that. Why? Because it's a producer of serotonin in your brain. Also, as if you try to get out and take some sunlight, you will get warmer, and when you get back home, you will feel different, because as plants, we humans, if we have a balanced diet and also avoid excessive caffeine and sugar intake, we will feel a lot better with ourselves and also with our bodies. Not talking into a physical way, but into a neurological. Well, if you take a lot of sugar, then that gets you anxious, because it happens that you are not in a normal amount of candy, then you are getting anxious, and it also affects your mental health, and that's the tips we are trying to avoid. Now, 7, quality sleep. Prioritize good sleep. Establish a consistent sleep schedule, create a relaxing bedtime routine, and ensure your sleep environment that it's comfortable. Why? Because you have to take seriously the hours that you sleep. You have to take seriously the time you get for yourself to get to relax, because also that helps the brain. If the brain is working the whole day and the whole night, then it won't work well with time, because then you will feel tired, and the tiredness also gets you in a bad mood. And if you're in a bad mood, then you'll feel anxious. And if you get anxious, then you will overcome more of the mental health issues that here we are trying to give you some tips for you to be better. Set realistic goals. Break down to tasks smaller, manageable goals. Celebrate achievements, no matter how small, to boost your sense of accomplishment. Sometimes we are willing to get to do a lot of goals in our everyday life, and sometimes the time is something we don't have, and that's okay. And you have to be okay with the small goals of every day. Every task that you accomplish every day, it's something you can celebrate. For example, I got up earlier today and I got to do my hair routine. That's a great goal. Or today I was in my entrepreneurship, and I made a deal, an important deal. Both of them are accomplishments and they're willing to be celebrated. 9. Seek professional support. Don't be afraid of it. If you're struggling, consider reaching out to mental health professional. Therapy can provide a supportive space to discuss your experiences and develop coping strategies. It's not coping strategies where you are feeling judged, because when you go to therapy, there's a professional that knows about some tools that can help you to cope with your everyday life situations. Sometimes we are afraid to go to therapy because we are tempted to think that we're being judged and that we're crazy. But we have to normalize and to start thinking, what can I do to be a better person? Not to cure myself, not because I'm crazy, not because I'm sick, because you and your body needs to be taken seriously. And if you want help, well, you can get it by seeking a professional support. Gratitude practice. Regularly reflect of things that you are grateful for. This can shift your focus toward positive aspects of your life and promote most optimistic outlook. What does this mean? If you're every day thinking about the bad things that are happening in your life, that you didn't got a job, that you're feeling blue, that your boyfriend broke up with you, those are valid things. Those are things you have to consider because they are part of your life. But also, you have to prioritize being grateful for the things that are working in your life. It's simple. If you wake up every day and think about 3 things I'm grateful for now that I open my eyes, then your day will start differently because your brain will associate the good and the positive things to think about to being thinked first than all the bad strategies and all the bad things that happen in your everyday life. So here are some of the tips that you can take into account to get a more conscious life, in a life that with some tools and a real process you can feel better. These are some tips we got to have from the article we mentioned earlier that's related with the COVID-19 mental health of the pandemic associated with social isolation. So these are certified tips from therapy and psychologists that you can look for, and also be patient about every process.
Resources and emotional support currently available. First, we have the mental health hotlines. Many countries have mental health hotlines that offer immediate support and guidance. These hotlines are often staffed by trained professionals who can provide emotional support and connect you with the appropriate resources. These kinds of options, national and international organizations like the National Alliance on Mental Illness, Mental Health America, and the World Health Organization provide information, resources, and every support that you need. On the other hand, we have the therapy counseling services. Professional therapy or counseling can be accessed through mental health professionals such as psychologists, psychiatrists, or licensed therapists. Many of the therapies offer remote or online sessions.
As a psychologist, it's crucial to pay attention to depression in the context of the pandemic, seeing from a comprehensive perspective. The current situation has led to significant changes in our daily life, include like social distancing, economical concerns, and adapting to new work forms. This also contributes to increase our levels of stress, anxiety, and ultimately the depression. Understanding how uncertainty, fear of illness and loss, as well as deprivation in our daily routines and social activities, can impact our mental health is essential. The lack of social connections and the restrictions imposed by the pandemic can have a negative effect on the psychological well-being. In the assessment process, we also consider individual coping strategies for instilling resilience and providing effective tools to manage stress are integrate aspects of the therapeutic approach. Additional, advocating to access to a mental health service and working to find a solution that facilitates seeking professional help are crucial. So it doesn't matter what the other people say. It's good for you to see a psychologist. They are happy to see you. Thank you.
More tips. Community mental health services. This consists in that local mental health clinics and community centers may offer counseling services, support groups, and other resources. Contact your health department or community organizations for more information. The second one is educational resources. Libraries, online platforms, and mental health organizations offer you educational resources on various mental health topics, and to understanding more about your mental health can empower you to seek and appropriate to support it. Examples include Headspace, Calm, and Mood tools. The third one is the religious or spiritual support. For some individuals, seeking support from religious, culture, or spiritual leaders can be helpful, and the support for this topic, many religious for organizations offer counseling services or pastoral care to help you.
Finally, over the course of the pandemic, many adults reported symptoms consisting with anxiety and depression, with approximately 4 out of 10 adults reported these symptoms by early 2021, and then it declined approximately 3 in 10 adults as the pandemic continued. Now, we are willing to and inviting you to get these statistics lower. Here, we are happy that you have enjoyed this program about how the COVID-19 affected our mental health, the consequences, the analysis, and what can we do about these problems right now to get better in our everyday life. Thank you so much, and this was everything for our program. Let's see you in another session.